basic anatomy and the biomechanics of the shoulder joint.
The shoulder joint, made up of the humerus bone and the glenoid of the scapula, is characterized as having the greatest amount of motion in the body. Compared to other joints in the body, the shoulder joint is extremely loose, which allows tremendous amounts of motion to reach up, around, and behind the back. Injury or disuse may result in loss of mobility and therefore loss of function. The anatomy of the shoulder joint can be broken down into two main categories: static and dynamic stabilizers. The static stabilizers are the articular capsule, ligaments, and bony configuration. So these are tissues that don't contract but serve as a means of support for the shoulder. Here is the articular capsule, which completely encircles the joint and helps to maintain stability. Within the capsule are three main bands of tissue that enhance this stability at certain ranges of motion. The superior glenohumeral ligament is the main restraint of inferior translation with the arm at 0 degrees of abduction, or by the side. The middle glenohumeral ligament is the main restraint to anterior and posterior translation at mid-range of motion, or about 45 degrees of abduction. And finally, the inferior glenohumeral ligament is made up of two main structures, the anterior and posterior bands. The anterior band is the main restraint to inferior translation and external or lateral rotation at 90 degrees of abduction. The posterior band helps to stabilize the humerus as it translates posteriorly. In patients that present with a frozen shoulder, the ligaments and capsule become excessively inflamed and tight. This will restrict the normal motion from occurring and limit the patient's function. The dynamic stabilizers consist of the muscles that surround the joint, so these are muscles that contract to produce movement. One of the main group of muscles that help to dynamically stabilize the shoulder are the four rotator cuff muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis. The supraspinatus's line of pull allows it to compress the humeral head as the larger deltoid muscles try to pull the humerus bone superiorly. The infraspinatus and teres minor are both external rotators and work with the subscapularis muscle to further compress the humeral head within the concave glenoid. It is this mechanism combined with the labrum that encircles the glenoid rim that helps establish normal joint movements. When the rotator cuff muscles contract, they pull on the joint capsule and cause it to tighten up. This essentially aids in controlling the ball, or humeral head, as it resides in the socket, or glenoid. As you can see, if the capsule or the rotator cuff are not functioning correctly, then a dysfunctional movement may occur. Over time, this could lead to further pain, weakness, and the inability to use the extremity during activity